everyone, and welcome to Bridging the Gap, Language Without Barriers. I'm Kaylin Choi, and today we're exploring an issue that affects millions of people worldwide, language barriers in healthcare. For non-English speakers, a routine visit to the doctor can quickly turn into a stressful and even life-threatening situation. Medical terminology is already complicated, but when patients can't fully understand their diagnosis, treatment options, or medication instructions, the consequences can be severe. This topic is personal to me. My Korean grandparents have faced many challenges in the healthcare system simply because English isn't their first language. My mom often steps in as their translator, but that comes with its own struggles. The pressure of translating accurately, the emotional toll, and even privacy concerns. To fully explore this issue, I've invited several guests who bring first-hand experiences and professional insights. My Korean grandparents, who will share what it's like to navigate hospitals and pharmacies without fluency in English. My mom, who will discuss the emotional and ethical challenges of translating for family members in medical settings. Miss Gloria, a former physician, who will talk about how doctors handle communication barriers and what's missing in the system. Miss Sophia, a Korean nurse, who will share what it's like to work with non-English speaking patients and whether hospitals provide enough support. And Miss Atlas, a nurse practitioner who is also my mentor, will discuss how language barriers impact medication safety and patient understanding. Some of the conversations with my grandparents will be in Korean, and also Miss Sophia's will also be in Korean, and I will translate their responses into English to ensure accessibility for all listeners. There's so much to discuss, so let's jump right in. To start, I want to focus on personal experiences. Healthcare is supposed to be about healing and care, but when language barriers becomes a barrier, it can create stress, fear, and even dangerous misunderstandings. So today I will be interviewing my Korean grandparents, and I will be playing their interview in Korean, and then I will have a translation overview on the top. Can you share a time you had difficulty communicating with a healthcare provider? My grandpa responded with, "We mostly visit a Korean-speaking family doctor, so communication hasn't been a big issue. But when we had to see a specialist for an x-ray, we relied on a Korean translator who was available at the time. It was a bit concerning at first, but I trusted the doctor. The fast-paced environment was a little overwhelming, but I still felt confident because they were professionals." My grandma responded with, "Our family doctor speaks Korean, so I don't usually have problems, but my pharmacist explained medication instructions in English, and it was too complicated. I often just nodded and said, 'It's okay.' I use hand gestures to communicate when I don't understand. I didn't feel rushed at appointments, especially at the specialist hospital where they had a Korean translator." I asked, "Have you ever worried about getting the wrong treatment or medication due to miscommunication?" My grandma responded with, "I'm familiar with the medicine I take regularly, but I do worry when I'm prescribed something new. There was a medication that caused severe hair loss and weakness, and I took it for 5 years without knowing the side effects. I really wish pharmacists explained those things more clearly." While my grandparents' experiences highlight the challenges older patients face when navigating the healthcare system in a second language, I also wanted to hear from someone who often helps them bridge the gap. So next, I sat down with my mom, who often takes on the role of translator for a family, to hear what it's like being the go-between in these important medical conversations. You've had to translate medical information for my grandparents many times. Can you describe a moment when you felt overwhelmed or uncertain about how to explain something?
Yes, I felt overwhelmed when I couldn't fully explain medical terminology. Coming from a background as an 11-year-old immigrant who had to explain difficult medical terms to my parents while also trying to understand them myself.
Have you ever worried that you might misinterpret something important or leave out key details?
Yes, all the time. So since I worried that I might misinterpret something important or leave something out, I would always write down what I understood before translating it to ensure I didn't miss any important things.
Do you think doctors sometimes rely too much on family members to translate instead of offering professional interpreters?
Yes, there were times when we could request professional interpreters, but it would take a long time for them to be found or called. So instead, I prefer to interpret and translate myself, as it was much faster and allowed me to provide a more personal translation. When my parents didn't understand something, I could explain it in simpler terms to help them. Whereas professional interpreters would often translate word for word rather than elaborating on the meaning.
What is the hardest part of being a medical translator for family? Is it the pressure, the emotions, or the responsibility of getting everything exactly right?
Well, honestly, there aren't too many difficult things because I have some experience with medical terms and the medical environment from working at a doctor's office in the past. But one thing I prefer is being physically present with my parents when translating rather than using FaceTime or the phone, as it allows me to explain things more thoroughly.
As my mom's story shows, language can be both a bridge and a barrier in healthcare. Her work as a translator highlights the importance of communication in supporting patients from diverse backgrounds. To explore this further from the perspective of a medical professional, Miss Gloria, a former physician, will explain the challenges faced due to language barriers. So, as a doctor, what were some of the biggest challenges you faced when treating patients who didn't speak English fluently?
I have to say it must be with the non-effective communication. When you have a communication problems, then people cannot understand the severity of the illness or the medication and why they are need to take, and thus they have a lesser the correct follow-ups and they are not taking medication correctly.
Oh, okay. So were there moments where you felt frustrated because you couldn't properly explain a diagnosis or treatment?
Most frustration actually comes in when it actually involves decision making process, especially with the severe illnesses such as cancer. When the patients cannot understand pros and cons of a certain treatment options, and they cannot make an adequate decision for it, and thus sometimes their illness gets worse, and even the death can come. So that's the most frustrating moment.
Oh, so like patients can't like figure out like things that are best for them. Okay. So how did hospitals handle translation services when you were practicing? Did you feel like the system was sufficient or lacking?
Either way, both ways actually. Common language just such like Spanish. There's more services available. There's more people available for in-person translation or even communication for telephone communications. However, when it comes to the lesser of the common foreign language, then there's a lesser of those service. So depending on what the language is that they're speaking.
Okay, so it depends on the language. And then like Spanish has more translation services, whereas like other
Definitely
languages don't.
Spanish has a lot more services available.
So like the languages that isn't Spanish, there isn't as much translation services available.
Yes.
Okay. Have you ever seen a medical error or misunderstanding occur because of a language barrier? What happened and how was it handled?
Definitely. A lot of times, some of the patients actually not just due to language, I guess, like the language itself, but sometimes they only hear the selected part of the communication part. So sometimes medications get missed, be picked up, and sometimes follow-ups are missed, especially after surgery when they're supposed to come remove their staples. Some people will forget, or they did not understand that they need to come back to remove the staples. So when they come, because they still have the staples in place, wound gets healed a lot worse. And so a lot of times in those situations, I do usually hand out my written handouts. But as you can see, those are all in English too. So I'm hoping maybe they'll ask somebody who they know can translate.
Oh, okay, that makes a lot of sense. Okay, hang on. Miss Gloria's insights as a former physician reveal the depth of compassion and adaptability required in healthcare. Building on that, I had the opportunity to speak with Miss Sophia, a Korean nurse whose experiences further emphasize the importance of cultural understanding. I asked Miss Sophia, as a nurse, you interact with patients more frequently than doctors. How often do you see patients struggling because of language barriers? She replied, quite often. Many of the patients I encounter don't speak any English, which makes it difficult to fully understand the symptoms they're describing or grasp the impact their condition is having on them. I asked, what strategies have you used to help non-English speaking patients feel more comfortable and informed? At our clinic, we use visual aids and charts that include Spanish translations. Even when the chart is in English, the Spanish portion often offers more detailed instructions. For example, phrases like, I'm going to change your position, are easier for them to understand in their native language. I've noticed that people respond better and feel more at ease when they're spoken to in their own language. I asked, do you think hospitals provide enough resources or training for healthcare workers to handle language barriers effectively? She replied, we do get some training, but when it comes to more serious situations, especially those requiring consent, a certified translator is necessary. In many cases, family members help with interpretation, but it's not ideal. I think larger hospitals tend to have more translators available, but I'm not completely sure. I hope translators are being implemented well across all hospital sizes, because it definitely makes things easier. Miss Sophia's perspective as a Korean nurse highlights how culture and compassion intersect in healthcare. Language barriers in healthcare won't disappear overnight, but there are things we can do to make the system more inclusive and accessible. We can see this accessibility through the opinions of my grandparents who have first-hand experience in this topic. I asked, what would have made your experience easier? If you could ask hospitals to change one thing, what would it be? My grandpa said nowadays it's much easier to find Korean translators at big hospitals, which helps a lot compared to the past. It reduces the burden of trying to understand complex medical explanations. My grandma responded, I feel like pharmacies don't usually have translators, especially at the front desk. I think that's something the healthcare system really needs to fix. I asked, do you think technology like translation apps is helpful or do they sometimes cause confusion? My grandpa responded, translation apps and newer technology are super convenient for translating medical information, even if they make the occasional mistake. My grandma responded, I agree that they're helpful, but they can't replace having a person explain things clearly and kindly, especially when it comes to medication.